The horse either stumbling or tripping repeatedly, in front or behind, or exhibiting a repeated bilateral hind limb toe drag. Here we see a hind limb stumble, and here a forelimb stumble, and here bilateral hind limb toe drag. Sudden changes of direction against the rider's cues, or spooking. In this image, the horse was trotting along beside the fence and spontaneously turned to the left. So this is a change of direction, not following the rider's cues. And this is an example of spooking. Reluctance to move forward, defined as having to be kicked repeatedly, so repeated use of leg cues, with or without verbal encouragement, or the horse stopping spontaneously. So in these images, we see repeated use of leg cues, and here we see a horse stopping spontaneously. The horse bucking and or kicking out backwards. And finally, rearing. When we applied this 24 behavior ridden horse ethogram to lame horses and non-lame horses, we found statistically significant differences. In the non-lame horses, the median and mean ridden horse pain ethogram scores were 2 out of 24, with a maximum score of 6 out of 24. However, for the lame horses, the median and mean scores were 9 out of 24, with a maximum score of 14 out of 24. So we see this depicted graphically here. On the y-axis, we have the ridden horse pain ethogram score, and on the x-axis, we have the lame horses on the left and the non-lame horses on the right. And we can see that a small proportion of the lame horses have low scores, but the majority are greater than 8. The horizontal blue dashed line represents the cutoff value of 8. We believe that a threshold of 8 out of 24 indicates the likely presence of musculoskeletal pain, although some lame horses score less than 8. It is important to recognize that any individual behavior may be caused by a variety of different factors. It is the importance of the total score rather than the display of individual behaviors. So my take-home messages are that abnormal behavior, I believe, has become normalized. A ridden horse pain ethogram score of 8 or more out of 24 indicates that there is a problem, even if you cannot recognize overt lameness. Further investigation using diagnostic anesthesia is needed to determine the sources of pain, and then through diagnostic imaging, we can determine the causes of pain and therefore initiate strategic treatment and management. I hope that this will help to dispel the fact that behaviors are just because a horse is naughty. And I'm going to provide further evidence for this in part 2. So this is part 2 of the ridden horse pain ethogram. In this section, I want to discuss further studies that have validated the use of the ethogram, to describe how to use it, and to discuss the uses to which it can be put. The first study investigated the behavior of lame horses before and after diagnostic anesthesia was used to remove pain-causing lameness.